Hi, Donna, if you would like to introduce yourself.
My name is Donna Murray. I am a 50-year-old member of Trinity United Church of Christ. I joined the church 4 years ago as I was delivered here in Chicagoland area because of medical needs.
Can you tell me a little bit about your healthcare story?
9 years ago, I was diagnosed with coronary artery disease that was discovered as I went to a doctor's appointment thinking my asthma medicine was not working properly, only to find out I had a 99% blockage in one of my arteries. At that time, I was given an emergency stent placement and taken care of and put on medications. And after that, I asked, what could I do, how could I do, and what could have contributed to this. I found out that because both my mom and dad had died from heart disease, and my mom at a very young age of 50, that I was really a high risk for acquiring the disease, and I then had it. At that point, I then said, what can I do to prevent this and now to change things? And I was told that probably cardiac rehab with different types of surgery and things. At the time, my insurance company told me no. They said I could not have that. I said, well, you have just paid for me to have emergency surgery, to be transported to multiple hospitals, to go through all of these things, but you will not pay for something that's $600 a week. And that could be preventative for me. And now I'm afraid because you don't know if this can reoccur or whatever. Well, I had 3 stent placements in less than 10 months. And the head of Emory thoracic surgery told me that it was in my best interest that I have a coronary bypass surgery.
Tell me more why the insurance company said they wouldn't do it.
They talked more about my age. At the time, I was 40 years old, and the fact that they didn't know how long I would need cardiac rehabilitation, exercises, and assistance with that. And with all of those things being so short-natured in time, I then went into the depression with all of the multiple medicines. I also went into the issue of my cardiac problems exacerbated my asthma symptoms, which I had confused my cardiac issues with. I had a doctor who was very well aware of me as a patient, which is why I understand the importance of you having a public option and an insurance policy that can take care of people with pre-existing illnesses. Because what I described to him was normally my asthmatic symptoms, but it was not. It was coronary symptoms. That would repeat itself, as I stated, 3 months. I then, like I said, was not given that. I tried to exercise on myself, but I then became very fearful because my mom had died in Chicago on a bus from a massive heart attack. So I didn't want to take any exercises by myself. My husband had to go back to work. I then went on with the bypass surgery. It was a very traumatic experience. I had some complications with my surgery of how I healed. That had to do with the way my blood works or whatever. Those things were complicated by how the medical profession dealt with me. They thought as a young woman I was more spaced out with the illness, and it was more depression, so I was misdiagnosed. I took it upon myself and just decided to leave Atlanta, and I left my family really to come and get medical care in Chicago because I had been in pain, chronic pain, or debilitating pain for about 7 months. When I arrived here, I basically went to Rush Presbyterian, which another cardiologist friend had sent me to. In doing that, I was out of the area, but I was covered, and that's what's so important about a universal health care. Because we had a wonderful policy, it allowed me to go from state to state and be seen. The problem was with what that coverage could be. Now, after I got here, we realized, guess what? I wasn't depressed. I knew I wasn't. There was a real pain issue, and I had not healed properly. The same bypass artery that had been transported from my mammary arteries and transported and connected to my heart was clogged again. So all of that, they didn't do the additional testing on me. They didn't do whatever. So I was walking around with a bypass that really hadn't worked.
Could you tell me a little bit more about